In a campaign from the International OCD Foundation and the Mighty People, they put forth the question on the International OCD Foundation's official Twitter feed, describe OCD. Adam Cleveland Walker of Evanston, Illinois, quoted is quoted as saying, "Imagine all of your thoughts, your worst thoughts, as a soundtrack running through your head 24/7, day after day." Sadly enough, he is not alone. Hello, my name is Destiny Johnson, and I myself, along with my sister, suffer from varying degrees of OCD. Today I will inform you of what OCD is, the degrees of OCD, and how it is treated. Firstly, we must define OCD. OCD, or as the medical term is called, obsessive compulsion disorder, is defined in the Diagnostic and Statistical Manual of Mental Disorders as obsessions, which are recurring thoughts and impulsions that can cause anxiety, which can lead to the suppression of thoughts or impulsions or the actions to neutralize said thoughts and compulsions. Compulsions are the repetitive behaviors and mental acts that are the reaction to obsessions or the preventative measure to prevent these actions in an unrealistic way. Now that we know what OCD is, we can now discuss the varying degrees. The varying degrees of OCD are checking, which is the compulsion to check things such as windows, locks, repeatedly, and they can also be compelled to do these things based on the obsessive fear of what could happen. Contamination. Contamination comes in two forms. You have physical contamination, which is the compulsion to clean or wash because of the obsessive fear of being ill or death. And then you have mental contamination, which is the compulsion to cleanse because of emotional or verbal attack. Next is hoarding. Hoarding is the obsession with items and items that are no longer useful, but because of the obsession, they can no longer throw these items away. The nextly, you have rumination, which is the train of prolonged thoughts on topics that are unproductive, while you have intrusive thoughts, which are obsessional thoughts that are rarely ever acted upon. Now that we know and understand the different degrees of OCD, the treatment for them all are quite the same. Treatment for OCD, according to Drs. Lauren M. Caron and H. Blair Simpson, who wrote the practice guidelines for the treatment of patients with OCD, cognitive behavioral therapy is the most common and beneficial way to combat OCD. And this particular therapy option also yields full recovery in some cases. Exposure and response prevention therapy is one of the CBTs or combative cognitive behavior therapies that states that you're exposed to your trigger or what makes you anxious or feel the need to act on the obsession or compulsion, and therefore you are then subjected to ignoring the compulsion and finding a way to not act upon it. Now that I have told you what treatment is used to combat OCD, I would hope that you would understand the nature of this disorder. Today we have covered what OCD is, the degrees of OCD, and how it's treated. With a lifetime prevalence of about 2.5%, OCD is the fourth most common disorder, the fourth most common mental disorder, according to Katrina Stellinger and Sebastian Ulbrich and others who worked on the mental health treatment seeking patients with OCD impact on age onset. They have to let us know that myself and Adam are no longer alone. Thank you. My name is Destiny Johnson.